One of the big stories that continues to confront parents, especially as we're on the clock effectively, almost the 11th hour, so to speak, of kids going back to school, is whether or not all the safety protocols are in place, and children's safety is paramount. Now there's a doctor who's raising a concern that perhaps the COVID-19 tests on children may not be the be-all and end-all, and tell us everything we need to know. That doctor is Dina Kulik, pediatrician and director of Kid Crew Pediatric Clinic here in town. Dr. Kulik, good to have you on the Oakley Show. Good afternoon.
Good afternoon, and thank you for having me.
So you have some apprehensions about the tests for kids for COVID-19. How so, and why is that?
I do. I can say that there's no gold standard for the testing. What we do now is we do what's called an NP swab, or a swab inside the nose, and it's the same test for both kids and for adults. And we have no gold standard to compare it to. What I mean by that is because there isn't a test that we know is really definitive, we can't say with any certainty how reliable or accurate the current testing measures are. And I can say from my own professional experience over these many months taking care of hundreds of kids that had viral symptoms, some of whom had parents or other family members that tested positive for COVID. Many of these kids, most of these kids, actually tested negative for COVID, and this would be the same in hospital-based settings and other testing sites. Many kids have been sick, and yet almost none have swabbed positive in the setting of having confirmed cases that they were exposed to.
So you're saying the testing is inconsistent or just way off. It's not reliable. What is the gold standard, by the way? What would be 100% foolproof? Is that even possible?
It doesn't exist yet, so there's nothing to compare it to. Even the antibody testing, we also know is inaccurate. There's a lot of pieces to this. It could be that the test itself is just not that accurate or reliable. It could be that the virus doesn't live so close to the outside of the nose, and therefore you would have to go much deeper than we expect to. We do know for sure that the amount of virus that you have in your nose varies based on where you're at in the illness process, whether you're asymptomatic, you're early in terms of your symptoms, you're very sick. Even people that are admitted to the intensive care unit, even the kids that have had things like Kawasaki disease or multi-system inflammation, where we're pretty certain these kids have COVID, a lot of these kids are swabbing negative, and some of them even have negative antibodies. So I find it very hard to believe that the test to be relied upon. And my concern is that if we're heading back to school and daycares and we're using the test as a measure to tell us whether it's safe for a child to return to a school or a daycare setting if they have a negative test, I am very concerned that this is going to lead more kids to go back when they're still shedding the virus, still potentially at risk of passing on COVID to others because they had a negative test that is unreliable and inaccurate.
So what's the conclusion? That testing in and of itself being ineffective is unnecessary, or do we still do testing? I mean, Dr. Allison McGeer, who you may know as an infectious disease specialist, is saying, it's probably on the order of 90 to 95%. Is that not good enough?
I don't think it is 90 to 95% for kids. I think that's pretty likely impossible, to be honest. If you look at hospital settings that only see children across the country, they've swabbed tens of thousands of children and almost no one is positive. I think that's impossible. And again, many of these kids that we're swabbing have history of direct contact with family members that do swab positive and they have the same symptoms. I have kids that were in quarantine when we were in quarantine, had no other exposures, other kids that were sick at all, and yet they got sick. And the only explanation I have is that they got COVID. Because there isn't any way to tell at the moment how reliable or accurate the test is, I'm not saying not to do it. I think it's a reasonable thing to do because it has somewhat more reliability and accuracy in adults, it seems clear. However, if we're relying upon this test to tell us whether a child is safe to return to school, I think that is a mistake. I think we'd be better off being conservative. And if a child is unwell in any way, whether they swab or don't swab positive or not, I think those children should remain home from school when possible for the next 14 days while we're waiting out that incubation period and that period where you're still contagious. That, I think, is the most conservative.
Well, isn't that what's being recommended as we speak? I thought, if anybody shows any symptoms of any kind of disease, they're taken out of the classroom setting and are sent home. You were saying 14 days of quarantine. I think at that point it suggested they get tested along with the family and if negative, they go back. But is that the problem? You'd like to see them taken out of the school setting and quarantining for 14 days, regardless if they got the sniffles, maybe a cold, the onset of, well, let's say the flu season in October, for example. You just want them taken out and quarantined for 14 days. Is that right?
I do think that'd be the safest bet at the moment. Now, the thought around this going back to fall season, illness season, that is absolutely true. We're heading back to school when we normally see more viruses. But if we are doing our best job at preventing COVID, which is another respiratory virus that also spreads by droplets like influenza, if we're doing our best to prevent against COVID, we should not be seeing a rise in influenza and other viruses because we're washing our hands, we're wearing masks when we can, we're minimizing contact with others. We should have less viruses in the fall and winter than we normally do because of that protection. So I don't expect to see a surge in these illnesses unless we're not doing what we should be doing to prevent against COVID as well.
I believe that expectation can be fulfilled if we stay on these regimens because they've had that experience in the southern hemisphere where they're coming out of their winter, haven't we?
Absolutely. So Australia in particular has had a bit of a mess with COVID recently, but they did see less flu in their flu season. If we're safe about it and we're patient, I think that's the biggest piece here. We're very eager to get back to normalcy, but it's not normalcy right now. And the best we've done is because we've been really patient and diligent, right? Canada, by and large, has done incredibly well throughout COVID by putting in place all of these measures like distancing and masking and minimizing contact with others. If we continue to do the same thing, I don't anticipate we're going to have a huge rise. It's when we start having classes of 30 kids and unmasking and being indoors versus outdoors, that's when the risk becomes it's higher.
Dr. Kulik, isn't the real issue that the kids may spread the contagion to parents or the elderly? There was a study out of the UK I was reading about today. Don't know if you've seen it, but it says the chances of anything serious befalling a child are pretty much negligible to none. And so they say, yeah, the kids are going to have sniffles and the flu. Brace yourselves for that. But otherwise, the contagion is not going to do anything to them except for, maybe the anomaly here or there. But otherwise, is it really about the spread potentially to the parents in the home or the elderly?
That is a big piece for sure. By and large, children have done amazingly well throughout COVID. Most kids are probably asymptomatic or very minimally symptomatic. We have had some chronic inflammatory response in some kids, as I mentioned, Kawasaki disease and multisystem inflammation. That's the short term. However, we don't have long-term data yet. So one thing that I'm curious about as we get into 6 months, 10 months, 12 months of this, what is the long-term impact? We do know in some populations we've seen longer-term inflammatory problems like renal problems and heart inflammation and lung inflammation and chronic migraines. There are some longer-term side effects we don't even know because we're only, a few months into this. There's too many unknowns. And so I still think we should be minimizing contact to our children and ourselves. And 100%, if a child gets sick and comes home, again, even asymptomatic, which most people are for sure asymptomatic or minimally symptomatic, which is great for that individual, but they can pass it on to their parents or their grandparents or other loved ones that are higher risk. And I want people to be able to see their grandparents.
Well, Dr. Kulik, let me ask you, it may be theoretical or practical, I don't know, but would you send your kids back to school in another week and a half?
At the moment, I'm thinking I'm going to move to a virtual platform to start. I'm not against sending them later, but the more I think about it, the more hesitance I have. It also depends on where you live. There's some areas that have lots of COVID and some that have very little. And your classroom setting might have 10 kids or might have 30. So I think there's a lot of, variability across the country and even, region to region. So, it's a hard decision. I have 4 children and I'm a working person who has a business. I totally understand people want to get their kids back to school and for many other reasons too, physically, emotionally, mentally. Some children are feeling very isolated. Some children are living in homes that are unsafe. Some children aren't eating enough because they're not in school. So there's many, many reasons to, get kids back to school. But I do think that the smartest way, the way that we're going to minimize the risk of another outbreak is to be as diligent and as cautious as we have been. And I do think that relying on testing to tell us whether we should go back, if we're safe to go back, and for sure no longer contagious, that I think is a piece that we have to think about really carefully.
Finally, just out of curiosity, I mean, when the flu season does come around and there are colds and things like that, the COVID-19 test would not distinguish or perhaps recognize the strain of flu that might be prevalent in the fall, will it or won't it?
Well, the COVID test will look at just COVID. There are influenza swabs and other viral swabs that we use to detect other illnesses like influenza, like a very common illness in kids called RSV. That testing is actually pretty accurate. So I would feel more comfortable relying on that. You know, if you do a swab for COVID and you do a swab for influenza, if the child has influenza, that doesn't mean they don't also have COVID, but at least you know they do also have influenza. But again, if we're really diligent about preventing the spread of COVID, that will also be preventing the spread of influenza and other viruses.
Fair enough. Well, let's just take that under advisement. Appreciate all these different inputs as we're trying to sort through the minefield of whether or not the kids should or shouldn't go back to school. Every parent has to make their own decision based on the best relevant information. And thank you for supplying some of that this afternoon, Doctor.
You are very welcome. Stay healthy and safe.
And you, Dr. Dina Kulik, Pediatrician, Director of Kid Crew Pediatric Clinic.